my name is Sinead Boyce. I'm a mental health nurse working within Cork Adult Mental Health Services. I work as an advanced nurse practitioner in psychotherapy, but within our services there's lots of different types of mental health nurses. If you were to attend the adult mental health services, you'd meet mental health nurses in lots of various positions. So you might meet them, you'll meet them in the community, you might meet them in the hospital if you needed to be in hospital. You may have a community mental health nurse who would call to see you at home. You'd meet them within the crisis teams if you needed a home-based treatment. In the day centres, day resources. So you'll meet nurses, mental health nurses in lots of different roles within the mental health services. So when you first meet a mental health nurse, the most important thing I suppose would be for them is to establish a relationship with you, to make you feel comfortable, to empower you to make decisions about your care. They'll obviously go through an assessment with you, as you'll have seen probably with other services, giving you options around your care. They can talk to you about your medication, they can talk to you about therapy options, go through, really give you a run through the whole entire service. And then I suppose depending on what nurse you meet, so if it's a community mental health nurse, they might arrange to come and meet you at home and set that up. If it was a home-based treatment team, they'd also meet you at home. If it's in a hospital, they'll be making you feel comfortable, orientating you for your stay. Or if it's in a day resource, they might be introducing you to a group where you could attend a group. The role of the mental health nurse is really to support you throughout your therapeutic journey. We have lots of different nurses, as I said, at different areas. They will have the skills to form a very important therapeutic relationship with you, and then maybe to offer some specialist interventions. We have lots of different clinical nurse specialists and advanced nurse practitioners in different therapeutic areas, such as family therapy, cognitive behavioural therapy, compassion-focused therapy, mindfulness, eating disorder specialists, and various other therapies. So if you were to be referred to one of these specialists, they would be meeting you probably on a regular basis, maybe weekly or fortnightly, offering one-to-one for the most part, or sometimes group intervention, working with anxiety, depression, self-esteem issues, lots of common emotional disorders that people might experience. So they would have skills to help work with your distress, hopefully giving you the skills to reduce that and regulate emotion. Mental health nurses work within the community mental health teams. So when you attend for outpatients, your consultant might discuss with you, the various nursing services. You might first meet a nurse for assessment, or you can ask about the various nursing services, like I've mentioned, maybe a community mental health nurse to visit you at home, or to attend some of the specialist nursing services. Again, I suppose these services would be very helpful, hopefully, in facilitating your recovery and allowing you to feel empowered to make decision making around your own care. I love working as a mental health nurse. I suppose every day is very different. It's very rewarding work. It's lovely to see people go through that full journey of care, come out the other side, happier and healthier.